Hello, everyone. For our team's health communication plan, we chose to focus on fall prevention in adults age 65 and older in Florida. Our fall prevention team consists of myself, Alicia Rowland, Holly Fugit, and Allison Metcalf. And now I'm going to kick it off to Holly, and she's going to talk about the health issue of falls in older adults.
The health issue that we are going to be discussing today is falls and emergency department visits among older adults aged 65 years and older. Falls are actually the leading cause of emergency department visits among this population in the state of Florida and is one of the 20 costliest medical conditions in the United States. For this communication, the primary audience is older adults aged 65 and older who have a fear of falling, live more sedentary lifestyles, don't travel far from home unless necessary, and possibly have a fear of exercising. There is a secondary target audience consisting of family members of the primary audience and primary care providers of these same individuals. When focusing on this health issue, barriers are to be considered, such as transportation and individuals' beliefs. Beliefs can be a barrier when an individual believes exercise isn't relevant in fall prevention, the individual is in denial they are at risk for falling, exercise is going to be too painful or too difficult, and the overall belief that falls are just a part of becoming older and it's inevitable.
The goal for our health communication plan is to reduce the overall incident of falls and injuries at home in adults 65 years and older in Florida. The overall program objective is 6 months after the launch of the fall prevention campaign. Adults 65 years and older will understand why fall prevention is an important safety factor in their home, and unintentional falls will be reduced by 30%. The outcome that is hoped to be achieved from this campaign is to increase awareness and knowledge in older adults of how to prevent falls. The overall long-term objective is to reduce overall fall risk by 50% and to achieve better outcomes regarding falling at home. Also, to lessen the healthcare burden of ER visits and reduce overall healthcare costs associated with falls.
To communicate the message that exercise can help prevent falls, the team chose a simple message that is easily understood. Exercising is hard. Falling is hard. Choose your hard. The message is impactful because it supports older adult choice and autonomy, as well as illustrating potential outcomes. The plan uses a flyer, which can be printed and also adapted to Facebook for advertisement placement, and also a physician tear-off pad that resembles a prescription pad for physicians to use in consultation with their patients. Both the flyer and the tear-off pad are adaptable to the local area because they provide a space to insert local resources such as physical therapy clinics and senior centers to help establish an at-home exercise plan. To implement the plan, the health education team will first contact physicians' offices and senior centers to arrange face-to-face meetings in order to obtain support and participation. Next, the materials will be printed and distributed. Flyers will be distributed to senior centers, and both flyers and tear-off pads will be distributed to physicians' offices. Physicians will be briefed on using the tear-off pads and documenting in the patient's charts. A digital version of the flyer will be placed on Facebook. The program will be launched in conjunction with Fall Prevention Week in September.
To successfully measure the fall prevention campaign, the quantity of flyers distributed to physicians and the primary audience will be tracked and accounted for. We will use a questionnaire that will be administered to patients before and after the campaign to measure knowledge and awareness of fall prevention. A phone survey will also be administered to ask the primary audience if they received the health communication campaign and if they contacted their local resource that was recommended on the flyer. The percentage of older adults who are sedentary 1 year after implementation will be tracked using the annual Florida Behavioral Risk Factor Surveillance System data book. The number of older adults who visit the emergency room due to falls 1 year after implementation will also be tracked by using the Profile of Non-Fatal Injury Emergency Department Visits section of the Florida Health Charts website.
So just to review, in this presentation, we discussed that falls are a health issue, being the leading cause of emergency department visits and one of the costliest medical conditions among older adults age 65 and older. We also discussed the goals of reducing overall falls and injuries at home with the objective of increasing awareness and knowledge in these individuals about fall prevention. Through campaign efforts, printed material, social media, and physicians, this will be a multi-pronged approach to reach the audience. The implementation is important to consider with distribution of material and launch timing, such that the distribution of materials will be in places such as senior centers, physician offices, and digital versions will be on Facebook. Lastly, we discussed evaluation through questionnaires and tracking the percentages 1 year after implementation.
Thank you for viewing our presentation. Exercising is hard, falling is hard. Choose your hard. References used for this presentation are found on the next and last slide.